Knocking on the door, checking the signs, see if I need to put on any PPE clothing, entering the room. Hello, Dawn, I'm Abby. Today I'm going to be a CNA. I'm going to be performing nail and foot care. Can I see your wristband, please? When's your birthday?
11/13/1971.
Okay, I'm going to close the curtain for privacy. I'm going to set up my overbed table with a paper towel, a nail file, my orange wood stick, nail clippers. I'm going to make sure that I have paper towels, lotion for the hands, petroleum jelly for the feet. I'm going to make sure that I have a washcloth, hand towel, and a bath towel. I'm going to have my wash basin, my kidney basin, and soap, and then also gloves. I'm going to make sure that my patient doesn't have any socks or non-skid shoes on. I'm going to place the bath towel underneath my patient's feet. I'm going to take my wash basin, fill it with 2/3 of water, the temperature the nurse told me to, or and fix it if it's too hot or too cold for my patient. I'm going to place the wash basin underneath my patient's feet, making sure that the feet are soaking, and then I'm going to adjust the overbed table over my patient, take my kidney basin, fill this 2/3 with water, about the same temperature as the feet or whatever's comfortable for my patient. I'm going to place this on the overbed table and place my patient's hands soaking. The nails are going to soak for 5 to 10 minutes, and then the feet are going to soak about 15 to 20 minutes. So then I'm going to, after they're soaking, I'm going to remove the kidney basin and take my orange wood stick and clean underneath the nails and wipe on the paper towel after each nail. I'm going to take my nail clippers and clip each nail straight across, and then I'm going to take my nail file to file the ends to make sure that there's smooth edges and no rough edges. Then I'm going to make sure that my lotion is warm, and I'm going to use that to put over my patient's hands on both of them. And then I'm going to move the overbed table to the side so your hands aren't on it anymore. And I'm going to remove my gloves, throw them away, and then wash my hands and put on new gloves. I'm going to take my washcloth and I'm going to lift one foot out of the wash basin. I'm going to clean the heel, the bottom of the foot, in between the toes, soap and water. And then after that, I'm going to put it back into the wash basin to rinse, and I'm going to rinse in between the toes and the feet. Then I'm going to do the same with the other foot, in between the toes, the heel, making sure. And then I'm going to put it back into the water basin and making sure that it's rinsed. I'm going to place my washcloth onto the side. I'm going to take a towel and pat dry my patient's feet, and then I'm making sure I get in between the toes, placing that to the side, other foot in between the toes. And that's going to go into the floor. I'm going to take my water basin and place it to the side. I'm going to take my lotion or the jelly, and I'm going to put it on both my patient's feet, all around the foot, making sure I get the ankle underneath, but I'm not getting in between the toes. I'm going to remove my gloves and wash my hands, and then I'm going to help my patient put on non-skid footwear. I'm going to remove the bath pad and discard of that. I'm going to ask my patient if she's comfortable, if she needs anything else from me today.
No, I'm fine, thank you.
Okay, I'm going to replace the call light, and according to the care plan, I'm going to raise or lower the rails. I'm going to clean, rinse, dry, and dry my equipment and return it to where it belongs. And then I'm going to wipe down the overbed table with a dry paper towel. I'm going to discard of that. I'm going to check the room for safety, making sure that nothing can harm my patient, like sharp objects, anything on the floor they could fall over, mouthwash, toothpaste, etc. I'm going to remove my gloves, wash my hands, and leave the room to record and report my observations.